Hi, this is RxHelp, advice from a person on the other side of the pharmacy counter, and today I'm going to be talking about acne. But before I begin, let's do some quick acne true or false questions just to see how much you do know about acne to start with. Okay, so true or false? Certain foods, especially greasy ones, can cause acne. False. Foods have absolutely nothing to do with your complexion. So don't feel compelled to give up the chocolate and the greasy stuff just yet. But giving up greasy foods is healthy, so you might want to think about giving them up anyway. Popping pimples gets rid of them fast and is totally safe. False. Popping and even scratching pimples can make them worse, can cause scarring, and in some cases can cause serious skin infections. So don't pop them. People with acne don't clean their skin correctly. That's why it's so horrible. False. People with chronic acne actually tend to clean their skin better because they're busy trying to clean it away. Cleaning your skin and washing it over and over doesn't necessarily take away acne, especially if it's becoming a chronic problem. I can only get acne as a teen, so once I'm in my 20s, I can relax. False. Some people don't develop acne until they are adults, or in some cases with some women, they don't develop acne until they get pregnant. If you have severe acne, you must not have treated it right, so it's your own fault that you have it. False. The severity of some cases of acne has nothing to do with how much you've treated it and how much you haven't. A lot of times it has to do with genetics. Not treating it can make your acne worse or cause it not to clear up, but it has nothing to do with severe, extreme cases. Having acne means I'm not attractive. False. Acne does not have anything to do with attraction. Look at all the celebrities and models that are spokespeople for Proactive. So how did you do? If you didn't do so well, or if these facts are new to you, you should definitely stick around to find out more about acne. Acne happens for several reasons. There's a huge number of reasons why it may happen. Most often it happens due to the hormone influxes that happen in your teenage years, which is why we most attribute acne with teenagers. But it can have a lot to do with the kind of genetics you have. If one of your parents has acne, you can be likely to, you can be more likely to get it. It can be caused by a certain type of bacteria. P. acnes is its name. So there's a lot of different factors. But really, I'm not here to give a lecture about what acne is and where it comes from. I'm here more just to give you advice on how to treat it, especially if this is the first time that you've really developed acne. Say you're 12 or 13, and you've never had a case of acne before, and oh my god, you have zits all over your face, and what do you do because there's this girl or boy that you really like, and you really want to kiss them for the first time, and they're not going to like you because you have zits all over your head. So this is really an advice for people who really haven't had to deal with acne, and this doesn't have to be little pre-teens or teenagers. This could be for, like I said, adults who just developed acne who've never had it before. So really this is just for first-timers. Those of you who have chronic acne probably know exactly what I'm going to say, and so this might seem a little redundant to you, but it's always good to go over it. But really this is aimed towards people who have never had to deal with acne before. So basically, there's a couple different products that you can use to treat acne, but the most important thing to have a combination of is a cleanser and a treatment cream. And there's a lot of different ones. You just go to your local drugstore and you're going to find tons of them all over the shelves. And you're probably going to stand there and go, oh my god, which do I pick? How do I know what to pick? So here's some tips on how to pick it. Let's start with washes, scrubs, those type of things, cleansers. because those are important. It's very important to make sure your face stays clean. Even though a dirty face doesn't lead to acne, if you don't clean your face, you're not going to help clear your pores out. And really, cleaning helps unclog your already clogged pores. Basically, most washes that you're going to see are going to have a compound in it called salicylic acid. Now, salicylic acid is related to aspirin. It's basically almost the same thing. In fact, you can make aspirin masks that will do the same thing as cleansers, and I'm going to put a link in my information bar to Phan's aspirin mask thing in case you want to make your own home remedy aspirin mask, because it is really cheap and easy, and she really does good explanations, and so I'm going to put a link to that. But anyway, salicylic acid containing washes, if you are allergic to aspirin, please do not use this, because it is basically the same thing as aspirin, and I do not want a person to have an allergic reaction to it just to get rid of a case of acne, because it could be potentially deadly. And as far as pregnant women goes, there really hasn't been much in the way of safety and efficacy defined with any of the treatments that I'm going to talk about that contain active ingredients, so I would use more natural remedies. But most cleansers and washes and scrubs do contain salicylic acid, so that they help treat the acne while you wash your face, which is very good. But they can cause a lot of dryness. Most of these products do cause dryness, so that's the major side effect. But there's a couple that do not. Purpose soap is probably the best for anybody who has extremely sensitive skin or a lot of skin allergies, because it's fragrance-free, it's hypoallergenic, doesn't contain salicylic acid, and it doesn't suds up. Cetaphil. Cetaphil is probably one of the most gentle cleansers that there is. They have cleansers and moisturizers and a lot of stuff, and they don't contain anything that's really going to dry out your skin. So it's very, very gentle, and it's good if you have sensitive skin. Neutrogena's Deep Wash line, most of them do have salicylic acid, but the Relaxing Nightly Cleanse does not. It's the one that's purple. But you have to be careful because it does contain certain dyes. Some of them do. They contain like red dyes, blue dyes, yellow dyes. So please just read the information in case you are allergic to it. L'Oreal's Go 360 Degrees Clean. They have a line of products, and 3 out of the 4 of them do contain salicylic acid, but the one marketed for sensitive skin, which is the blue and white bottle, does not. And it's really neat because it comes with like a little cleansing pad in the bottle, so you can use it to exfoliate your skin while you're cleansing. So it's kind of neat. It helps pick up the dead cells and remove them very well. Those particular products do not contain salicylic acid in the cleanser. The rest of the cleansers and scrubs and washes and face masks and everything contain salicylic acid, so just read the back. It'll say up the top, active ingredient, salicylic acid 2% if it contains it. Or if you read in the actual ingredients down the bottom for a lot of them, it'll say salicylic acid. Basically, there's 2 types of acne treatment gels. There's salicylic acid, again, and there's benzoyl peroxide containing creams. There are also some that contain sulfur and resorcinol, which do treat it as well, but the 2 most commonly seen are salicylic acid and benzoyl peroxide. Both of them work equally well, and both of them will take care of mild cases of acne. One piece of advice that I have is don't use a salicylic acid containing cleanser followed by a salicylic acid containing treatment cream, because double the exposure is going to equal double the dryness. Also, if you're going to use the salicylic acid cleansers followed by benzoyl peroxide, that's also probably going to cause dryness. And it's probably also going to cause your skin to feel like it's burning, especially if you've never used either of them before. So I would say, if you're going to use a salicylic acid cleanser, just use that. Maybe a spot treatment if you've really got a really stubborn one. Like, I've got a stubborn pimple right here, right now, and it's not going away, so that's okay for me to spot treat if I need to after I use a cleanser. But then if I'm going to put the benzoyl peroxide all over my face, I would use more of the calming cleansers, the things that don't contain salicylic acid. My favorite is Cetaphil, because it's very gentle. But that's really my one piece of advice when choosing your cleansers and creams, is try not to use them together, because it probably is going to cause dryness. Also, the things that market themselves as cooling gels, they market themselves that they'll soothe the soreness. They contain alcohol, because if you've ever felt somebody give you a shot and wipe you off with an alcohol swab, it feels cool for a few seconds, but alcohol dries out your skin. So besides the salicylic acid that you're getting, or the benzoyl peroxide, it's going to dry your skin even more because it contains alcohol. So I would kind of stay away from those. I would use either a nice moisturizer if your skin is very dry, or an ice pack to kind of dull the burning sensation if you're at home. If you're headed out, I would say just try to deal with it. Try not to bump your pimples. Take precautions to stop yourself from feeling pain, but I would suggest not using them because they contain alcohol, and it's just going to dry your skin out more. So I'm not going to be going over the application process. I'll do that in a second video, where I not only show how I would apply it, but also how to avoid redness, burning, and dryness. I have two last pieces of advice. Women, if you're wearing makeup, please wear non-comedogenic makeup. And if you're exercising, don't wear any, because makeup plus sweat equals clogged pores. And if you are wearing makeup throughout the day, when you get home, please wash it off. Because the longer it's on, the more likely it is to clog pores, regardless of whether it's non-comedogenic or not. And my last piece of advice is patience with acne treatment. Give it at least 3 months to work. And you have to be doing it every day, because if you're not doing it every day, prescription creams are not going to help you anymore, because they have to be used every day too. So if you do not see any improvement, or you see worsening after 3 months, and you've been using it every day, then it's time to start thinking about going to see a doctor or a dermatologist to get some help. But, okay, I will see you all in part 2. Have a good day!